This year marks the 17th celebration of National Infant Immunization Week in the United States, and I'm told the 9th celebration of Vaccination Week in the Americas. Although National Infant Immunization Week started in the United States, it's really turned into a global event. And I understand that this week we're joining more than 180 other countries.
En 1991, por decreto presidencial, fue creado el Consejo Nacional de Vacunación, el CONAVA, con el objeto fundamental de coordinar las acciones en materia de vacunación de las instituciones que integran el sector salud y de los sectores públicos, social y privado.
It's important for everybody to cocoon or basically insulate our youngest and most vulnerable folks.
The role of the Commission is really important in this event of National Infant Immunization Week. Its purpose really is convening people, stakeholders, policymakers, the population in general, to understand, to have the information, and to assure that they're receiving the immunizations that are necessary.
Estamos inaugurando la semana que realiza en todas estas agencias de la salud fronteriza. Esta salud fronteriza es a nivel estatal, pero la gran comisión es a nivel nacional.
Mentioned this is the 9th vaccination week in the Americas. It started as an initiative to control the measles outbreak in 2003 that it started in 2001, 2002 in the northern Andean countries of South America. So it was a local activity that was actually spearheaded by the ministers of health of those countries to control the outbreak and prevent it from spreading to the rest of Latin America and to ultimately to anybody living in the hemisphere. And it's subsequently grown to an activity that is nearly a global activity. This is, of the 9, I've participated in 8 of them. It's always been a pleasure to see the improvement, you know, to see these achievements in coverage is amazing. And I think that the leadership along the border here, both between the U.S. and Mexico,
It's a wonderful opportunity to try to raise awareness throughout the globe, because really what NIIW is about partnerships. You know, we've got a healthcare system that's not all in one place. It involves lots of different players. There's healthcare providers, there's insurance companies, there's community health centers, and there's what families need to do too to get their children vaccinated.
Right now, from Brownsville, Matamoros, all the way to Tijuana, San Diego, there are events going on. So this is just one of those very many events, but this is the biggest event because this is the inauguration.
One of the things we're celebrating, really, is the importance of vaccinations. And over the last, really, 50 years, vaccines have changed the way we look at our culture and society. It's, you know, 50 years ago, families were in a position where they basically would hope that their children would survive. Today, we have an expectation that our children will thrive. And the reason for that is because vaccines have really eliminated many of the lethal diseases that we've faced over the last 50 years. And
el caso concreto de la campaña de vacunación, las ventanillas participan con aliados como lo que sucede aquí precisamente hoy en Tucson. Nuestra ventanilla, por ejemplo, de aquí de Tucson, de nuestro consulado en Tucson, está aquí en este evento de hoy, participando y sobre todo llevando información a los mexicanos, a las organizaciones de mexicanos que viven aquí, sobre el tema de cómo vacunarse y la importancia de que se vacunen no solo los niños, sino también los adultos.
Hemos tenido cambios importantes en la inmunización, hemos incluido nuevas vacunas que antes no estaban en nuestro esquema, hemos venido ampliando cada vez más el recurso que se aplica para salud en nuestro país y en gran parte nuestros niños, nuestras embarazadas, nuestras personas, adultos mayores se han venido beneficiando cada vez más.
It's my privilege to read this proclamation for Infant Immunization Awareness Week.
Muy importante la relación y la cooperación entre los dos gobiernos, entre México y Estados Unidos, en términos de dar información conjunta y cooperar de manera bilateral en dar información a la comunidad fronteriza. ¿Por qué? Porque la comunidad fronteriza es comunidad de nuestros dos países y conjuntamente es como podemos llegar a darles información, atender a estas comunidades. El gobierno de México y el gobierno de Estados Unidos tienen que actuar en materia de corresponsabilidad sobre el tema de la salud.
Nosotros estamos en el lado mexicano y hablamos sobre la salud. Nos queda muy claro que el otro lado es también nuestro lado y esto yo creo que es algo importante de mencionarlos. Tenemos un gran número de connacionales de Sonora y de México, en Arizona, en Nuevo México y en muchos otros estados del norte, para lo cual queremos agradecer el servicio que les dan.
Think globally, act locally, because I think this is an excellent example, and also you being here and participating, I just personally feel very honored and proud. So thanks again, and thank you, the organizers.
A todos esos pequeños, hoy los deben vacunar.